never prescribe a homeopathic medicine in these 4 types of cases because Dr. Hahnemann had written about it in the footnote of Aphorism 67 in Organon of Medicine on the basis of clinically and practical verification. It does not mean that homeopathy does not cover these type of treatment or it does not have homeopathic medicine for it. Of course it have, but after giving the right management first. Now let's understand one by one with examples that why Dr. Hahnemann had restricted to give medicinal aid at first. These are 4 conditions where Dr. Hahnemann restricted us for giving any medicinal aid at first. The number 1 condition is sudden accident. It covers mainly 4 common types of conditions like head trauma, fracture, open or severe wound or hemorrhage, severe hemorrhage. In number 1 condition, head trauma, we need to stabilizing the patient, ensuring adequate oxygen supply, blood supply to brain and preventing further injury or damage. In the second condition of fracture, we need to stabilize the fractured body part with the help of plastering or bandages for relocation and immobilization. In the third open or severe wound condition, we need to stabilize the wounded part of the body with the help of stitches and sutures. And in the fourth condition of severe hemorrhage, we need to stabilize the hemorrhagic condition by the ligature of the artery, etc. Second condition is asphyxia. In this condition, we need to stabilize the patient's air pathway of the lung by clearing it, the obstacles or obstructions. In the third condition of sudden poisoning, we need to stabilize the patient by neutralizing the poisoning agent or substance. In the fourth condition of suspended animation, there are some criteria Dr. Hahnemann included here like lightning, suffocation, freezing, drowning, etc. But practically we see one more condition which can we include it in the etc. word like sudden cardiac arrest. It's very common and we see it very frequently in the news channel or video clips, etc. So here in this condition, the patient requires CPR. This is the first part of the management, and after then the patient get relief by the proper medication. But here you can see all these conditions which are related to either trauma center or emergency ward, all these things are require management part first, after then medicinal aid. Mechanical aid first, then later on medicine aid. And at that condition, homeopathic medicines have very good opportunity for giving the full cure to the patient, because all these homeopathic medicine have been proven clinically and it's already written in Allen's Keynote and Allen's Keynote Repertory, Keynotes Modern Classic Repertory under rubric and sub-rubric with their medicines.
Subscribe our YouTube channel and press the bell icon button.